You're listening to the Turn Autism Around podcast, episode number 222. I'm your host, Dr. Mary Barbera, and I love when we have podcasts with round numbers like 222. Anyway, today on the show, we have a success story from Marie L., who has 2 school-age children, both diagnosed with autism. And Marie has made a lot of progress on her own, both during COVID and after COVID. And she just really talks a lot about how she has been working with the school to try to get him back in school and some of the progress that he's made. So it's a great session. The 2 things we started, which we talk a little bit in this podcast about, is one, we have a brand new course for parents of school-age kids. It's the Turn Autism Around course for school-age kids. Before this, which it just came out very recently, before this, parents of kids over the age of 6 were kind of lumped in with professionals, and I think it was a little bit too overwhelming. Now it is a step-by-step course that really gives you the need to know of how to get your child who is either not talking or talking in short phrases, but not conversational, how to get that child to progress up with language, to reduce problem behaviors, to improve picky eating, sleeping, potty training, and so much more. So you can check that out in the show notes here at marybarbera.com/222 to see how you might get joined up for our parent course. We also started a Train the Trainer course for professionals. We have started with cohort 1, so that is in session now for the next couple of months. So if you're a professional or a very advanced parent, you're going to want to look for when we start cohort 2 for our Train the Trainer program too. So we are making changes to support people like Marie and possibly you out there. So I wanted to mention both those new offerings right now. So let's get to this really great interview with Marie L. All right, Marie, thank you so much for joining us today.
Thank you for letting me be here.
Yeah, so you've been in our online course and community for a while now, and I see some of your posts, and you are one of those parents who have given us permission to talk about your kids. You've even shared videos, and you've shared your son's assessment, which we're using for our brand new course for parents of school-age kids. So first of all, I want to thank you for allowing us to use your story and use your videos to help other families. I really appreciate that.
Thank you so much for creating your courses and everything.
Yeah. Well, so we're going to talk about both your kids, Sean, who's 8, and your daughter, who's 11.
Yep.
And your 11-year-old just recently got the diagnosis. But mostly we're going to talk about Sean and your journey to finding help through our online course and community. But let's start with my usual question. Describe your fall into the autism world.
Oh, goodness. Sean was 3 and we took him to the doctors. He wasn't talking. He liked to clear tables. So if there was like anything on the table, it would be automatically just cleared right away. And I took him for his physical, and the doctor goes, I'm pretty sure he has autism. And at that point, I didn't know what to do. I didn't know where to go or anything. We did end up getting him into a preschool that was for autistic children. And then as time went on, I couldn't get him potty trained. And that's where, by 5 years old, you're going into kindergarten. What are you going to do if you can't get potty trained? They didn't want him in public schools with a diaper on. So I called up Sean's developmental doctor, and, I'm kind of at this point almost begging, because I'm like, I don't know what to do. And I was really upset. And she goes, just go out, buy Dr. Mary Barbera's book. And I'm watching my daughter play in the playground. I can remember this, and I'm writing everything down at the moment. And she's like, go buy that book and just use it. And there's a section in there about how to teach your son how to go potty. So the next day I went out, I bought it, and then I just started using it, and he got potty trained, and he went into kindergarten. This was before, like, the pandemic hit that March. So he went to kindergarten in September, but he was fully potty trained. So that was a
And
huge
that was, you
win.
just used my first book, The Verbal Behavior
First book.
Approach.
Yeah. Yep.
Wow. So your doctor recommended the book. There is a whole chapter in both my books. In Verbal Behavior Approach book, there's a potty chapter, and then in Turn Autism Round book, there's also a potty chapter. So that helped him. And how was his language when he went to kindergarten?
He was on PECS because that's what he was trained on before. He really, I want to say he didn't have much language at all. He wasn't even saying daddy at that moment. Very, very little in kindergarten. When the pandemic hit, that's when I started really getting nervous, because if he's not around a professional, or if he's not around therapy, he's just going to get into a regression. That's what our fear was, my husband and I. And that's when I found your courses.
Okay. So that was the spring of 2020. And he was just the spring of his kindergarten year.
Yeah.
Is when you found it. And that's when actually a lot of people found my online course, because every child in the United States, both regular general education and special education and preschool and daycare, they were sent home. And that's just a lot. And even before that, I started my first online course in the spring, March 21st of 2015. So it's 8 years ago, almost to the day when this podcast comes out. And 8 years ago, I started the online course. And, some of the parents along the years, parents haven't taken my online course, have said, I just want to be the parent. I want to leave it to the professionals. They didn't know, and they still don't know, that there's so much parents can do and should do. But I think the COVID-19 pandemic really did kind of wake everybody up to the fact that, the professionals are going to come and go. And when they close schools, you're it. You're the teacher, you're the advocate. You're the only one who has the power to really change things. And luckily I also had my book proposal in and a contract to write my book in January of 2020. So I started writing, and some of my case studies, including Michelle C., who's in chapter 8, 9, and 13, and she now works for me as a coach, and she made all kind of progress during the COVID shutdown. So Sean was 6-ish at the time, and
he was 6 because his birthday's April 2nd. So yes. Yep.
So what kind of gains did you make with the online course?
Well, I started first with the toddler courses, and it took a little while, and they used to have the Zoom up. So we would do the Zoom, and it was almost like I was trying to swim and learn my footing. And I kept saying, okay, we need more reinforcements. We need more. And as I got my footing, Sean was like really getting used to all of a sudden sitting at the table, and he would like to come over. And like, I noticed that even if it's small, it's not small, it's a win. So he would come and he would sit at the table willingly. He would bring, wherever I had at the time, the therapy tools, just like you said, and he would bring that over, and we would do different things. And that was all, and the language started coming to the point where his teacher, because they would do Zoom again. So like we had to see his teachers and stuff. They were reading, I think it was a book. I don't know what book it was, but as they were counting the numbers, Sean goes, 8. She goes, oh my God, he just said that. And yeah, we've been kind of
working on stuff.
working. Yeah. but she just was huge, like so impressed and so excited. And that was just in 2020. So, I mean, and that happened. But again, I was still getting my footing.
Yeah, yeah. So you completed the toddler course,
Yep.
and then did you move to the verbal behavior bundle?
Oh, I moved to everything. I
Yeah,
completed everything.
yeah,
And I did it a couple times because I got to refresh. I've got a lot. I juggle a lot. So I like to make sure that I'm doing the right thing. And
mhm,
there's nobody else usually for me to ask except like on your Facebook group. I might post a question, which is I do like that Facebook group.
yeah.
It's been feeling lost. I could post a question.
Right, right. Because, and that's why I created the courses, because I used to travel internationally and speak on stages and, for an hour. And then people would have all these ideas. And then on Monday or Tuesday, they'd try it and they're like, oh my goodness, my kid is throwing potato head. Mary's videos didn't show a kid throwing potato head. Or flopping on the ground. Now what do I do? But there was no way to ask, like, hey, I
Right.
watched this, I'm trying, but he's running the other way. What am I doing wrong? And it's not like you're doing anything wrong. It's just that these procedures work. It's just a matter of you might have to adapt something. You might need
Right.
different reinforcers and different situations. And that's really where our coaches and our Facebook advisors and our community manager can help. So Sean did end up going back to school between
He
after that.
did. He's made a couple of attempts going back to school. He ended up going back. It was like 2020, yeah, 2021. He ended up going back. We it's been a couple years. Kind of
Yeah.
gets but he did end up going back, and we ended up pulling him. Well, it was kind of a mutual agreement because he ended up at an ABA clinic first. And like from April to October of that year, he was at the ABA clinic from like 9 to 3. And there were other children in this clinic. It was an ABA. I thought it was good. I trusted the BCBA. And then when the time came for him to transition from there to school, she left out the part that he would get upset sometimes and pull kids' hair. I didn't know that. School didn't know that. The only one who knew that was the BCBA. I mean, he never did that with his sister. So I'm just kind of like, where's this coming from? And he got back to school, and this was in October, and he pulled a kid's hair twice. And then he went down like to, almost bite. And at that point, the CSE called, and my husband and I were like, we don't want anyone hurt. We're gonna homeschool them, and I'll take care of them, and we'll go from there. I got in touch with the BCBA, and I asked her, did this ever happen there? And she said, yeah, it did. And I said, why? At that point, I was more like, why didn't you let us know? Because I feel like if the teachers if they had a heads up that, hey, or if I had a heads up, maybe things could have been different. More
Yeah.
information, I feel like, is better than less information, especially when you're dealing with a child with autism.
Yeah. One of
But
the biggest things I find, and I've been in the autism world as a parent and then as a professional for 23 years now. And, if Lucas would go somewhere, or even Spencer would go to daycare or preschool or whatever, like there needs to be communication every day, not just a smiley face or a frowny face.
right.
Not just he ate, half a sandwich. Like, well, especially for me, because I'm a behavior analyst, but even for you, because you learned,
Yeah.
you had to learn
Yes.
COVID, you have been empowered to learn to become your child's best teacher and advocate. And, if he was aggressive at school, if I were in that school as a BCBA, I would for sure want to know, is this happening at home? Is it happening with siblings, cousins, play dates? Is it happening in the community? There
Right.
really needs to be not just communication, but collaboration. And, a lot of schools, public schools particularly, are like very hands off with school, with home stuff and community stuff. But that's a big part of it, especially when you're talking about a school age child. There
Yes.
needs to be some follow through and some collaboration. Otherwise, it really isn't going to be as successful as it could be. The other big thing legally, because I've also done several shows with advocates and attorneys and IEP coaches, and we can link some of those in the show notes. This is podcast 222, so that's always fun when we got a nice round number. Go get the show notes at marybarbera.com/222. But legally, one of the biggest things that should be highlighted and should be really a sure thing, at least in the United States, is the transition from one setting to another, from an ABA clinic to a public school setting, or from a birth to 3 program to a 3 to 5 program.
Right.
Both agencies or organizations are required to have a transition plan with present ed levels and problem behaviors, et cetera, et cetera, et cetera. And so that was a fail.
Yeah.
That transition and
Yes.
the lack of communication about severe problem behaviors of hurting children and being aggressive, it was legally not right. And it really did, it's not right on any level. But
No.
know that transitioning and communication and collaboration with home versus and school are part of the hallmarks of the Individuals with Disabilities Act. So, so you decided to homeschool. Now, do you get any homebound services or any speech services, OT, anything from the school?
Now I have them, the therapist email me. So like speech, OT, and PT will email me. Shawnee is seeing a personal trainer, as I put on Facebook, and he's doing really well with that. So that kind of takes care of PT. But
You have to pay for that.
we're in New York State. So Sean gets Medicaid, but
Okay.
also with Medicaid, he gets self-direct.
Okay.
So under his like bundle for self-direct, he can have a gym membership.
Okay.
And the gentleman that does it, he only works with special needs children and adults. That's all he does. And he is really good with Sean. And so we're lucky in that case, but he does enjoy it, which is
that's great. That's great. So just so you know, I've done some other interviews with parents, and just for the listeners out there, is that if if the school is not able to provide a free, appropriate public education, then they need to fund something that is comparable and suitable and appropriate. And so, we don't want to get too much into the legal, and we're not trying to throw anybody under the bus. Professionals out there are trying their very best, and you and your husband had to make family decisions based on, you knew you could handle it. You knew, whatever your work schedule was, not working, or, that you could handle this, but not everybody out in the world could even do it. You know what I mean?
Right.
They wouldn't have
I understand
the knowledge but just know, I think I told Zulika, she was on a 2-part episode a couple months ago, but I told her, she asked me, should I stop school? And I'm like, I can't tell you to stop school or not, but I wouldn't be sending a child anywhere where they weren't safe. They weren't, learning, they weren't making progress. They were screaming to go in. Like, I'm not going to send my child there. Obviously, it's not, something's wrong.
Right.
But I wouldn't just homeschool either and let, the system fail him, because at least in the United States,
Oh yeah.
they are required. So
Yes, they are.
so you are still homeschooling, but you
Yep.
do have a plan to get Sean back into school? And when do you think
Yes.
it's gonna happen?
Well, right now he had his evaluation. So normally, like every 3 years, you have to have an evaluation if you're special needs. So I had requested, since I was doing everything, I was doing therapy, your therapy. I said, can we just do a new evaluation before we have a CSE meeting to get him back into school? And the CSE said yes. So he completed all of his evaluations, and we have the date of March 24th for the CSE. So, and then we're going to talk about getting him back into school. And Sean's doctors both wrote letters to cover us as well, saying it's best if you get him back into school slowly, meaning he might go back in an hour or two, and then mommy comes and picks him up, just because they said you don't want to drop him at the deep end of the pool and expect him to swim.
Yeah, that's a
He's
good
been
idea.
homeschooled and he can make it. And that's the other thing you and your course taught me, is that, yeah, over a year ago, we went to church, and oh my gosh, it was up the choir loft and running and screaming. And it's like, we're going to get reinforcement. We're going to work on this we're going to do it. And his reinforcement was a train station. Shawnee loves trains. And every single Sunday, that's what we would do. And now we go to church and he doesn't even need the reinforcement. So it's just, again, it seems to some people it's a small, but it is such a huge win how much he's changed and grown.
Yeah, yeah. So those are good examples, starting out with just an hour or two.
Yep.
Or half a day then, or with mass. Maybe he likes, the end of the mass, or just the song part, or
Yep.
can't tolerate the homily. So during that part, he gets to go into the lobby and walk around before he has problem behaviors, and slowly shaping so that he can go with his family and sit through a mass, even if he has to have headphones on and not be paying attention. Like, some kids can't do that, but they can wear headphones and they can do their iPad and they can sit in the pew and the family can go to church. So
Right.
there's just different things. And I think that's where, our course and community really teaches parents like you, like, it doesn't have to be all or nothing. So I really appreciate your doctors really seeing that,
Yeah.
some shaping, we need some transition planning. That's where the transition planning comes into play. And, does the school have a BCBA, or could they contract with a BCBA who could start coming to your house, who could be part of that transition planning?
They do, but we'd be on a wait list with the organization that's like the BCBA for the school. So it's like a nonprofit organization, and then you would have to be on a wait list. It wouldn't just be, unfortunately, at the CSE meeting, because if they deem that he needs a BCBA at school, then it would be the BCBA would be contracted for like a certain number of hours at school only, and like I wouldn't be able to see her or him.
Well,
yeah, I know.
There are other ways to do it, because right now you're homeschooling him in lieu of an appropriate education. So
Right.
You could even say, as part of the transition, that BCBA can come home for 8 hours a week, and then she can go with him for the hour or two that he's going to push in, and then she can come back home. I mean, just because they haven't done it that way doesn't mean it wouldn't be a thing.
That's a great idea.
So think out of the box. I mean, you might need an advocate to make it happen. And we want to be as agreeable as possible. We don't want to get into a legal situation if at all possible, because it just wastes time and money. But at this point, it sounds like you're working with the system and they're working with you, but just because normally it doesn't work like that. Normally people don't homeschool their special education child for a year either.
Right.
So, he probably will need more of a better transition. So, we often say no therapy is better than bad therapy. Do you agree with that, or have you seen that in your life?
And no therapy better than bad therapy. I'm just thinking. Uh,
Well,
I've-
the thing is that you now know what to do. So he's always going to get some kind of therapy, even if
yeah,
it's just your good parenting, because you know about reinforcement and that sort of thing. So
I
we
guess.
say if it's a bad situation, it is better to just stop the bad situation and learn how you can make it.
Yeah, I guess if I was to tell myself, looking back before I found your courses, before I did all this, and like if Sean was having a meltdown and I didn't know how to act, to me that would be like, oh, I'm not doing this right. Whereas now, after I learned, and I can, oh, this, I'll give you a great example. Like one night, he emptied all of his drawers in his room, his dresser drawers, and he just emptied everything. And this was a couple years ago, and I walked in there and I just took a breath. I was like, okay. And I'm like, buddy, what do you want? Mickey, Mickey, and Mickey. And he wanted his Mickey PJs. And he was looking all over for his Mickey PJs. So I, rather than get upset, I like was thrilled that he told me what he wanted. And then I said, okay, bud, let's clean everything up. And he cleaned everything up, put it away, and everything, cleaned up all his drawers. But that's what he was looking for. So it taught me how to be a better parent. It taught me how to do things. And if I feel like if I didn't learn that, then yeah, it would have been different, if that makes any sense.
Yeah. So in the past, Sean is 9 at the time of this broadcast,
Yeah.
just turned 9.
Yes.
So in the past 3 years, what kind of gains did Sean make?
He's up to 300 words. He goes to the hairstylist every 2 weeks. He can sit there without me holding him or anything. He sits with his balloons now and his little bluey, and he has his haircut, very cute. He's going to a personal trainer. He's out more. He helps me with groceries. He helps at the, even just doing chores. Like if he, gets his shirt dirty, he'll take his shirt off, he'll change his shirt, and then he puts that shirt into the wash, which is, again, like huge.
Yeah.
So there's a lot of, again, little things, but when I started your courses, again, it's like I told my husband, we're focusing on self-care. And he brushes his teeth at night. He makes sure he's completely independent potty, making sure he can completely dress himself and stuff. And, we focus a lot on the mans and the tax as well, and the echoics. But I was really kind of honing in on this past year, making sure we're kind of doing that because I want him to be happy.
Yeah. And a lot of times parents and professionals, I think I did it myself, focus too much on language and not enough on
Yeah.
self-care and life skills.
Yep.
Because, those are super important, especially as your child gets to be 7, 8, 9, 12, 15. Language is great. And the fact that he can request or demand for, or tact 300 things and probably more than that,
Mhm.
starting to answer questions, starting
Yes.
to, be involved, but like going to the grocery store, going to church, going to a restaurant, going on a plane, those are all
Yeah.
huge goals that make more of a difference in the child's safety, independence, and happiness, and the families,
Yep.
than, 4-word sentences, which really doesn't do much for safety, independence, or happiness.
Yeah. One other example I could think of is, the oxygen.
The O2 sat machine for the,
He was petrified of that. So we had one that was, oh my God, I think it looks like a shark, and he's just petrified. No. And it's like, okay, we're going to work on it. So I made sure the reinforcement was extremely high. Every day it was like, working and working. And then he went to his doctor's and the nurse put it on. She goes, is this the same kid? Like, yeah, it's fine. But he is so good. And just for him, that was huge because that was the one thing he couldn't stand at the doctor's. But he's just been it's amazing how much he's grown. And at his developmental doctors, he goes, I'm all good. I'm all good. So he'll let you know if he's all good.
And how about aggression? Are you seeing any of that?
We're not seeing much aggression at all. No.
Mhm.
If he ends up with a migraine, we might see a little aggression, but no, we're not seeing any aggression.
Mhm.
And
Yeah.
migraines are migraines.
Yeah, and medical problems are a big
Right.
part of why some kids like Lucas had aggression and self-injurious behavior, and he still has SIB for pain or startle, mostly pain. So it's really important that we as parents really try to figure out any pain and try to figure out what med might help things.
Right.
I don't know if you've ever listened to the podcast with Dr. Michael Murray, who's Lucas's psychiatrist.
Yes.
We can link that in the show notes here, but um, you know, and I'm not prescribing any meds for your
No, I know.
but Inderol, which is a cardiac med, which is really the medication that saved Lucas's life, pretty much. That is to lower his sensory, just calm him down, keep him in
Mhm.
a constant state of calm, so he doesn't have that startle, fight or flight response. But that medication, that cardiac med, is also used for reducing tension of like violin players that have to play for like hours.
Oh,
I'm
okay.
just wondering, I think it might even be used maybe for migraines, but don't just think of medication as being like antipsychotics or antidepressants or
Right.
ADHD kind of meds, because and things progress over the years. So I would seriously, if he's having migraines, whether he would be typically developing or autistic, I would go full tilt, especially if that's causing any problems. And the
Mhm.
other thing is, make sure you have a paper calendar where you're keeping track of his migraines, his problem behaviors, his supplements or medications if he's
Mhm.
on any. I have a calendar video blog I've recommended numerous times. It's in my newest book too about the calendar system. We can link that in the show notes. So let's pivot a little bit to your daughter's 11, and
Mhm.
so she was recently diagnosed. So how did that come to be? And then we'll talk about how you helped her with some of the strategies.
Sure. She got diagnosed when she was 9.
Okay.
And of course, we had the whole pandemic thing. And prior to the pandemic, she was in a 15-1-1, which was like a normal classroom with just a teacher and an aide. But when the kids were going back to school and it was going to be, it was going to be difficult, we got a call from the principal saying that they didn't think that she could handle science and history and that she was falling behind. And
But
they
she
didn't
didn't
want
have an IEP or a diagnosis of anything at that point.
She had an IEP because she is behind in speech.
Okay.
She can talk, she can talk your ear off right now. But she is behind in speech. So she does have an IEP. And she did have OT and PT before,
Okay.
which she has since graduated from. But the principal had called us and was like, I think she needs to go into this other class. And this other classroom is a 12 kids, one teacher, 3 aides plus another aide. So 12, 1, 3, 1. And I was like, but at the moment, I'm like, why? She was doing so well. Why? What's going on? So we took her to our developmental doctor. We had her do some, she checked her out and everything. And then the psychologist checked her out and said, she's right on the line for autism. I said, okay, that for me, that's fine by me. It just means you're different. And I mean, she doesn't know. I don't want to say, she doesn't think she's like a bad thing. Like some people would say that it's bad or whatever. We always tell her, we tell both our kids, you're awesome, you're special. It's all good. But so we were planning on going on a trip this past year, November, which we did. But over the summer, I was working with her and with Sean, and Noelle's like, Mom, don't do what you do with Sean. I don't need potato head. I don't need those potato head. I know where everything is, because she sees me do, and she sees me with the everything with what you do. So I'm like, oh, okay. So I made her get a binder, and we got a pink binder, and she decorated out of it. And then I laminated sheets, and I made sure, we got everything kind of like together. And I'm like, this is going to be your book. It's not Shawnee's, it's yours. And every day we would go through it, and she would use, like, I had Velcro on it. So we would be doing like, I can't think of it at the top of my head. Like, if you get it wrong, I would tell her exactly what something she knows, like, where's your eyes, for example. Obviously she knows that. And then we would go back to transfer trial. It's the tip of my tongue. But we would go on, and that's how she really picked up sight words. And then she started picking up different things. So we would keep doing that. And like, I had to teach her some words are naughty. And we had to go through that as well, and just kind of teach her that, some words are, because you go to public school, you hear stuff, and it's not her fault, but we just have to, like, teach you. And when she went back to school in September, the teacher called me, and she said she couldn't believe, because normally the kids regress from June to September. And she just couldn't believe the progress that Noelle made over the summer between
Wow.
in math and in reading. And I made up my own sheets, and I made that binder, and I tried to make it as fun. She loves Disney princesses, so I made it as fun as I could for her. I kept the rewards like as high as I could.
Yeah. Yeah.
She sees me doing it with her brothers.
Well, a couple things I'm thinking for her, and we don't really talk about her much, but in our bonus video vault as part of the course, there's a fluency bonus video that you'll check out. I've also done a bunch of podcast interviews, one with Kim Behrens, Rick Cabina, Kelsey and Amy Evans. You'll want to listen to those. We'll put those in the show notes as well, because kids, like you're describing, your daughter, really need a lot of prerequisite training, fluency-based instruction.
Okay.
And instead of laminating sheets, I would use page protectors, because you can put worksheets inside, and then you can take out the worksheet and put different worksheets, because they need a lot of different things. And then finally, there's really inexpensive reading materials, like Teach Your Child to Read in 100 Easy Lessons is
Okay.
a $15 book. And if she is reading below like a second grade level, like instead of teaching her just sight words, I would teach her phonics. There's also programs called like Head Sprout and something else after Head Sprout. I think they're all based on fluency-based procedures, but I would caution against just piecing things together and really get some curriculums. There's direct instruction curriculums to teach math, direct instruction to teach language and reading. So in our verbal behavior bundle in the intermediate course, there's reading, math, language for learning, language for thinking, those sorts of things. You can also get the school, have an IEP meeting for your daughter, and have the school buy these curriculum, teach her with these curriculum, because the more you can catch her up, the better we will do. Yeah, so that's kind of my thoughts on that. But great job putting these, errorless teaching, error correction procedures, having independent workbooks, and not letting kids regress all summer, no matter if they have autism or not.
Right.
You really have taken this information and become, the gung ho parent that we love to see. So congratulations. I think you're doing an amazing job.
Well, thank you. Thank you.
Yeah. So before I let you go, part of our podcast goals are not to just help the kids, but help the parents and professionals. So do you have any self-care tips or stress management tools that you use to live a happier life with less stress?
I try to let it go. Well, if it's not, because with two special needs kids, things will come in, and if I get upset over every little thing, I'm gonna end up melting down before the week's end. It's just not gonna, I'm not good to anybody, so it's like when a problem comes in, kind of just like with, we assess it, okay, where does this problem fall? Is this like a really big issue that we have to worry about, or can we just take a breather and let it go for now and not worry about it? If it's something with the school, one thing we're working more with, trying to be give with honey rather than with vinegar, so to speak, because my husband and I are fierce advocates for the kids, but it's just sometimes you learn that it's better sometimes to be sweeter, even though it's harder at times. But I take time to just meditate, and I also take time to do to work out and give myself some peace. And what I can let go, I put in God's hands. And because I can't do everything, I need some help.
Yeah, especially when you're homeschooling.
Yeah.
Yeah,
I definitely need some help.
definitely need that self-care time, that's for sure. Well, I think, like I said, I think you're doing a great job. I think our courses and community, we're also taking some of, your feedback, people like you. We are now have a Turn Autism Around for school age, because the toddler preschooler course is so effective,
Yep.
really step-by-step guidance. But in the past, up until like a couple weeks ago, we didn't have like a really clear path for kids over 6, but now we do. So we have either the Turn Autism Around toddler or Turn Autism Around school age. And I'm really excited because we just started our first cohort of Train the Trainers. So like people at your school, that could be part of his IEP, that somebody take the verbal behavior bundle and take the Train the Trainer course eventually, so that it doesn't have to be parents and just a few professionals around the world really trying to get this method out to the world in a
Right.
child-friendly way. So I'm excited that we're going to have some more options. We're going to build capacity to get child-friendly ABA out to the world so that we can have kids like your Sean and Noelle making the best game. So thank you so much, Marie, for joining us, for sharing your stories, for allowing us to use videos. It really does make a difference in a lot of our lives. So thank you again.
Well, thank you.